And Dr. Burkitt, who's really a professional hero of mine, went on how to detail how in 1973 he was alarmed that 40% of the UK population were overweight, that 76,000 people were going to be diagnosed with colorectal cancer in the USA in 1973. And he warned about rising rates of obesity, type 2 diabetes, inflammatory bowel disease, and rheumatoid arthritis. So this was 50 years ago. And looking at the epidemiological data as it existed in 1973, he very firmly placed the blame on the westernized, low-fiber, high-meat, high-sugar diet, which contrasted with the diet that he'd seen during his missionary work in rural Africa. So almost 50 years later, as we've seen today, poor diet, the same things that Dr. Burkitt was worried about 50 years ago, is now the #1 cause of premature death and disability throughout the Western world. So the question today, guys, is can a whole food plant-based diet save us? And it's a big topic. I thought really that if a whole food plant-based diet is going to save us, it needs to be acceptable and it needs to enter the mainstream. So I thought I would turn to Ian and Henry first, who have quite a lot of experience in promoting a plant-based diet, both to friends, members of the public, to your online followers, and to Mr. Piers Morgan, most recently.
That was a lot of fun.
The ultimate vegan skeptic. So, what do you think, guys? Is the public on side?
Oh, good question. I mean, the public are getting more and more on side. Definitely not Piers Morgan, by the way. He's very, very much anti-vegan, and I think he's pretty much anti-everyone except himself. But it was an experience to go and spend some time with him and put ourselves very much in the limelight and right in front of his shouty, ranty, aggressive demeanour. In terms of can a plant-based diet save modern civilization? It's a very lofty question. I mean, it has to. Obviously, we're surrounded by healthcare professionals. We love what you guys do. It's absolutely fantastic. We're by no means medically trained, but we're incredibly passionate about diet and about food. And really, outside of medicine, just for the planet. The planet, you all know this, I'm speaking to the converted, but the planet needs us to buck up our ideas and reduce our meat and dairy consumption. You mentioned the new book. We have just put a new book, or we're working on a new book, where we're for the first time coming out of talking about just vegan food and starting to talk about healthy vegan food. So that's one book coming out in December. And yeah, that's going to be great. So we've worked with a dietitian. It's been an experience, trying to make sure we've got no reds on the old nutrition guidelines. Oh my goodness, that was a struggle. But we pretty much got there. But then also trying to make sure on the other book that we're talking about climate, because David Attenborough has come out there. He's the country's foremost journalist talking about nature and the environment and telling 1 million people that the #1 thing we can all do to save the planet is to reduce our meat and dairy. So, I mean, they have to save the planet, so otherwise we're all screwed.
Yeah. And Ian, having gone up against Piers Morgan amongst others, what are your top tips? How can we win the argument? How can we sell this? We can't just sit in our clinics and say, go vegan.
I mean, the best way we've found as Bosh has just been kill people with kindness. And no one really wants to be told what to do. No one likes to be preached to. But everyone, if they're a forward-thinking person, likes to receive information that is going to be of benefit to them. And you have to be really mindful about how you package the information you want to give them. Our packaging has come in the form of social media video and really tasty recipes that don't usually fit the sort of vegan stereotype. For instance, some of our recipes that we've done, it's all plant-based, therefore it's all completely free of cholesterol. It's all very, very delicious food that isn't too far away from what they consider to be normal. For instance, whenever I go back to Sheffield and cook for my parents, I think on one hand they're like, oh God, he's going to be cooking vegan food, but they always come away with a big smile on their face and asking for the recipe, so that's good.
Yeah, absolutely. I'll come to you guys, to the medical professionals in the middle, but just to pass it over to, you can use the mic? I think, if we're going to win this, if we are going to save Western civilization, we need the public on side, but we need the next generation on side too.
Oh, great.
We need the kids. Right?
Totally agree. Can I go off on a slight tangent here? Recently I've become really interested in soil. And if anyone isn't familiar with a doctor called Zach Bosh, phenomenal mind and great advocate for soil regeneration. And last week we were in a strawberry farm, strawberry and raspberry farm, one of the biggest ones in Ireland. And you know, anyone who's like, oh, British strawberries aren't seasonal, okay, stop eating, right? They're super healthy. And I was we kind of left it, like we ate, oh, I think it's gone. We kind of ate our body weight with strawberries and raspberries, and we kind of left, and someone asked me, how do you feel? And we both felt sad, and it was mostly, the strawberries weren't grown in soil, they were grown in coconut husks. They were fed food via water substrate, so we'd isolated just the variety of nutrients that were required to make the strawberries look great and taste great. But, you know, if anyone's interested in soil, there's so much diversity and so much wealth. And if anyone read a book called The Third Plate by Dan Barber, where he talks about in the Midwest of the United States, where as soil biodiversity decreased due to monocropping, economic prosperity decreased in conjunction with it. So I think as a society, it's a massive shift is that we have to go back to having soil biodiversity and our food actually being grown in the soil. Because I know plant-based is a huge thing, but it's also soil biodiversity, bees, all this is all connected. And I feel like I'm ranting and I'm sorry, but I feel really passionate about this.
But I think it's as well as vegan, I think we need to obviously, you being a medical professional, you want the most amount of nutrients as you can get. And if you're growing on a membrane that has very different nutrients because we've sprayed so much chemicals on it, I think we need to regenerate our soils. Like according to this Dr. Zach Bosh, he says, at the current rate we're going by 2070, in 50 years, we won't be able to procreate anymore. We will be infertile. And I think part of that is obviously down to chemical farming, but part of it I think is our microbiome, which Alan knows much more about that than I do, but like they say, the biggest areas of bacterial biodiversity on the planet is the soil and the human microbiome, and I think there's correlations between them. As we've been eroding our soil over the last 50 years, our microbiome has been too. So I think that's part of the story too.
Dr. Williams, you mentioned some phenomenal microbiome-related research. And it's becoming more and more relevant. Every study we look at about the microbiome, the answer is more plants, less meat, less dairy. Can I just throw you back to the question on the kids?
Oh, the kids, yeah.
You've done some work in schools.
Yeah,
you've gone into kids. You talked to them about plants and vegetarianism. How does that go?
Yeah, it goes, provided they're not junior schools. The junior schools, they just want you to swallow swords and juggle with apples. So they don't really listen to you. But if you can go to a higher, I know in September we're due to go to 13 schools in the period of a week. And the main purpose is to try to encourage people to make veg look more sexy. You know, if Diet Coke and sugary water can be sexy, why can't melons and cucumbers and, you know, more, anyway. You don't get that one. But even if I look at my own children, you've got it great. Even if I look at my own children, when my daughter May was born, she's now 8, I was adamant to my wife, that I wanted to raise her as a vegan because it was really, really important to me. And she kind of said the old adage, I think, or old, whatever the expression is, it takes a community to raise a child. And I was like, no, but I'm really important. And, you know, I lasted a while with her being vegan, but then when we went to, my wife's Polish, we went to Poland, and we left my daughter with my mother-in-law for even an hour. My mother-in-law was literally stuffing sausages or anything. So, like, it does take a community to raise a child, and I guess children learn from our own actions. My little son now, Theo, he's 6, he's decided to go vegetarian. The local manager of Super Value, one of the bigger supermarkets, Paddy, he stops Paddy every day. Paddy, stop selling meat, it's bad for the environment. He starts when we go to school, he picks up rubbish, and as a result, I pick up rubbish. And the other day, a lady stopped me, she said, I did a little post on Instagram the other day about Pear picking up rubbish, and she stopped me and said, I've started picking up rubbish too on the beach now. So it's amazing the impact, the little small things do make a difference, and every single day we do have a choice. And I'm saying this more to myself than to you guys, but...
and I was going to say, like, the biggest levers, I think, are our kids, because I know they say the biggest motivator for adults to give up give up smoking. The biggest motivator for adults to give up smoking is when their kids go, Daddy, I learned about smoking in school, you need to stop doing it. And it's a bit like if we educate our kids, get in and educate the kids, they're going to catalyse change within our parents.
And you already mentioned how kids will walk up and play and say, hi, will you be my friend? Kids will also come and tell you what they think.
Yeah.
And they're not going to hold
I don't
back.
like you.
No, I think they're getting that argument. You know, I recently was driving my 8-year-old daughter home from clubs, or her friends in the back. I try not to speak, so I know I just embarrass her by everything I do. But one of the girls said, "My dad just got an electric car to save the environment." And I was really proud to hear my daughter say, "Well, my dad gave up meat to save the environment." Dr. Williams, if a plant-based diet is going to save Western civilization, we need to convince our medical colleagues. We see papers, some of the guidelines you saw, you referred to coming out of the US, we got part in authoring, the guidelines on the prevention of coronary artery disease, the guidelines on the treatment of type 2 diabetes, both now explicitly mention a plant-based diet. So we get the impression over here in the UK that every doctor in the US is on this plant-based mecca. What's it like? Are you winning the argument?
I'm hoping so. You know, I've always said that I'm not quitting until it's no longer the #1 cause of death in the United States, but I've had to change that. I will quit when it's no longer the #1 cause of death of cardiologists.
Yeah.
It's really, it's tragic when getting to be my age and so many friends and people that I've worked with passing away from coronary heart disease after spending their entire career treating it. It's just very ironic. So I think there is some traction. I do have concerns that I wouldn't want people to film about the guideline process and how well we are able to diffuse into other societies. American Heart Association members and American College of Cardiology members and what we call sister societies, there's buy-in there. But, you know, cardiology, you know, there's a couple of issues. Number one is that we think we're seeing chest pain, shortness of breath, hypertension, diabetes. No, we're seeing the tip of the iceberg. It's primary care and family practice that are seeing these people. And how often do they follow our guidelines? Not much. The other problem is that I mentioned that in our population, the biggest area of cardiovascular to make a gain would be the African American population. And that if you are economically or socially deprived, you don't see specialists. And so you're seeing doctors who not only are they going to die of heart disease, but they have no idea what our guidelines say. So we really are on a mission to try to get those guidelines out into the hands of primary care. It's not easy to influence those organizations. I've really tried. That was the part I didn't want to film. I won't go into any details, but just really difficult to get these large organizations on board with our processes and the literature that we believe in because it's peer reviewed. So we're on a mission to try to do this, and until we're successful, I think cardiologists and physicians they have a leadership position. People come to you and ask what to eat, but we have it was one of my backup slides, a deficiency in education, and it's very sad when the president of the American Heart Association has a heart attack right at the meeting. He's doing okay. He got resuscitated twice. He's died twice that day, and he has a stent now.
You could argue he's in the perfect place, really.
Right? Yeah. No, well, I mean, but it's so ironic. And of course, it sends a message to the public that cardiologists do not know what the heck they're talking about, other than managing the disease. He got stented and he's still alive, and so we clearly know how to manage it, but can't we do better?
And Dr. Williams, you mentioned a number of barriers there, and I guess sometimes people don't realize that getting these guidelines done, often that's kind of a political process, It's just like sometimes evidence isn't enough. There's a lot of vested interests, there's a lot of groups involved, not least of which are professional societies. Sitting right next to you is a primary care physician who is very aware of dietary guidelines in terms of the conditions we've been talking about today. In many ways, I guess the plant-based medical movement here in the UK is maybe, 10 or 15 years behind you guys in the US. Sue, how are we doing?
I think, as you say, we're 10 or 15 years behind the US. When I first started talking about nutrition and lifestyle medicine to my colleagues 15 years ago, I got blank stares all round, and I got told to go back to my desk and be quiet and get on with prescribing the drugs, please. So I've since changed that. I've changed not just the colleagues, but the prescribing. Thank you. And My current colleagues are a lot more accepting of my views. They don't share them, but they sort of humour me. But I think we're growing. Gandhi famously said, first they ignore you, then they laugh at you, then they fight you, and then you win. And I think we're at the fighting stage. I've been laughed at a lot over the last 10 years, but I'm starting to see some real aggression now. As we know, the other diet that's very accepted in the UK currently is the low-carb, high-fat movement. And I'm delighted to hear that low-carb, high-fat vegan is fine, because that's something I'd quite like to do myself. But at a conference I was at recently, we had Dr. Michael Clapper as one of our keynote speakers, and he gave a truly extraordinary talk. But a number of the low-carb, high-fat doctors in the room got up and walked out before he even started speaking. They wouldn't even listen to him because it's creating such anger.
Which I mean, not least, that's terribly unprofessional.
Yeah.
You just walk out when a colleague comes to share some data. That's sobering.
It is. I must say that was a very small proportion of the audience, and it was a lifestyle medicine conference, so everybody gets a standing ovation at the end of every talk because it's exercise. You stand up and wave your hands in the air. But he not only got a standing ovation, he was the only speaker to actually get a cheer as well. So I think he won the audience, but it just demonstrated to me just how much fight there is in the UK at the moment, and the battle is real.
Yeah, absolutely. I mean, it's so. I mean, for all of us doctors and other professionals who are involved in this group and this movement, it does feel like that, doesn't it? But we're getting real glimmers. You know, I get colleagues referring patients to me now for dietary advice. And I mean, I work with a great team of dietitians as well. But if we've got patients with Crohn's or IBD in my hospital, the local GPs and gastroenterologists are sending them my way because they've heard me, they've seen the evidence. So I think the slides, the evidence, the studies, they're a little bit undeniable. And if you can get those in front of your colleagues, and we were talking about earlier about the lever of low cost effective care within the NHS. So broccoli is cheaper than expensive drugs and stents. And I think for us that's a major driver. We just touched on the environmental argument, and I know, that's something you guys have become really passionate about. I can't claim to be an expert. I don't recommend a plant-based diet to my patients because of environmental impact. I recommend it because of the positive impact on their health. Why you guys, a couple of chefs, why are you writing a book about the environment?
So I mean, I guess the first point would be, do we call ourselves chefs? We're like kind of home cooks, influencers. We're like those people who do various different things. But put us in a kitchen with 100 covers, and I dread to think what would happen. But put us in a TV studio with a big audience, and we can make meat eaters like the idea of a vegan meal. So that's what we're about. We're about that like easy on-ramp into vegan food. And in terms of the environment, I mean, environment is a really key driver. There's obviously animal agriculture, which is grimy AF. And even if you're a meat eater, like, everyone can agree that we're not that down with like factory farming and what's going on there. And obviously there's the health, which is a real big driver for loads of people in this room. So there's a load of reasons why going vegan is amazing. But actually, like, something like 93% of the people who bought the Beyond Burger were flexitarians. So it's a great time right now for us to be vegan and just, have all this food to eat. You go out in London, everyone's got vegan options, which makes it loads easier. But actually the cause of that is those flexitarians. I think the key message there is that, it's not really necessarily for us about convincing everybody to go vegan. It's about having a nice on-ramp and just showing them how delicious vegan food can be bit by bit. And by that same logic, like, if it's the flexitarians that are making the market forces change, that means Beyond Meat just sold for 5 billion, or just IPO'd for 5 billion, and everyone is buying these kind of alternative products. The same is true for the environment. We know that the leading cause of rainforest deforestation is animal agriculture, and people might say, oh, it's soybeans. Well, actually, those soybeans that are basically the soy fields that are being planted in the Amazon, like 70% of them are being used to feed the crops, the cattle, etc. So it's a bit of a kind of false friend there. But so we know that rainforest is not in a good place, carbon is not in a good place, there's water wastage, there's all of this bad stuff that's being caused by the animal agriculture, and it's for us it's about trying to make the message appealing to non-vegans, and actually even avoiding the word vegan entirely, and just trying to show people just how delicious one plant-based meal can be.
Yeah, with the whole environment thing. I remember like growing up as a kid, I used to be a scout, and every couple of Sundays, like the scout group would go around and pick up all the old newspapers and take them to the newspaper. So I was like into the environment from a young age, and also my parents have always been big advocates of pop the plastic in the plastic pot, put the glass in the glass pot, and put all the other waste in the other pot. So yeah, we've always been sort of like interested in the environment, but like really growing up, never had any idea that the impact that the food that you eat on the environment, you just completely didn't think about it at all. And I remember when we first sort of 4.5 years ago, sat down and watched Cowspiracy, it was like a light bulb moment. It was sort of like, oh my goodness gracious, you have like animal agriculture is like incredibly bad for the environment, full stop. And the more that we've kind of sort of got into this vegan thing, the more we've sort of become a voice for it, the more we've learned about it. And the point, we've always been about like, never the why you should go vegan, always showing people like how you can go vegan if you so wished. Like I think the more we've sort of filled our heads full of this information about exactly how bad animal agriculture is for the environment, we kind of felt like compelled enough to put all these findings and all this stuff that we've read into this text that we've just actually put the final touches to now. So yeah, we're not experts, not by any way, shape or form, but what we are is really, really interested, involved, and also we've got the weight of the shoulders of knowledge now, so we're kind of like, we need to share this with the world. So we've had this opportunity to go ahead and do this book.
Yeah, I think that's a really amazing point. Like that book. Who in this room has read The Uninhabitable Earth by David Wallace Wells?
I tried to, but the writing is so small.
Oh, it's hard. Yeah, we're audiobooking it. So this is. I think he was the editor of the New Yorker, and he was going deep on like Reddit threads about climate change, and he was seeing all of the writing was generally trying to show quite a positive slant about climate. And actually what he was reading was, this is quite a bad situation we're in, there's a lot of worst case scenarios. So he made a book that is basically all the worst case scenarios pulled together. We read that, well, we audiobooked it together, and it was shocking. But we're quite deep into this stuff. But then when David Attenborough, about 2 months ago, I think, we were in Soho Farmhouse writing this book, which was How to Live Vegan, which was just a how-to guide. And we didn't do the why at all. And that's been our message, has always been positive, spread positivity, show people how to cook food and not talk about why. But we watched David Attenborough and his incredible documentary, Climate Change: The Facts. Who has seen that one? Okay, so quite a few more. It's the same science, the same data, but it's made into a really clear and easy and visual format, easy for the general person, the general public to understand. I cried. Like, I was in tatters watching that. And the next day, woke up and was just like, okay, right, so this entire book needs to change now. Because although we knew the data in this quite acidic, quite kind of, quite cold way, having it visualized by this like statesman and made really digestible for the million people who are viewing that show, it was like, okay, this is real. Our children are going to suffer because of the climate. We are likely to have climate wars. And we can't just sit there doing recipes anymore. We need to come out from behind the fence and start talking about how bad it really is. But I think that simplification is key. The simplification of message is key, because most people need to be talked to in that way.
You know, even 5 years ago when I sat in my clinic and asked patients, so what's your diet like? They would say, oh, it's really healthy. Some days I only eat chicken. You know? But now, when I ask my patients, what's your diet like? They say, it's really healthy, because everyone says it's really healthy. They say, it's really healthy, there's some days where I'm kind of vegan. And that's even before they know my predilection. So I think vegan has become shorthand for healthy, and that in and of itself is going to drive change. Of course, the reason people are coming in with that opinion now is thanks to, you know, people like everyone sitting on the panel here, but also huge media outlets, not excluding, but including very much plant-based news, who share this message on a daily basis with about 500,000 subscribers. Robbie, I couldn't let you sit there without asking you a question, so I'm going to throw the mic. So, the great and powerful Robbie Lockie of Plant-Based News, you don't have to shout, it's turned off. So Robbie, as medical professionals, what what can we do to convince people?
I think it's obviously a lot of medical professionals don't have the knowledge when it comes to these topics, the environment, animal rights, ethics and stuff like that. And I think it's about getting educated, about spending some time learning and reading. We work really hard at Complex News, like what Henry Ian said, to simplify the message, because there's a huge amount of knowledge out there, and we're trying to pull in all those topics. Our YouTube channel is a great place to do that. We've done many interviews with Dr. Kim as well, loads of other doctors and nutritionists and environmental people. So I think, you know, spending some time on YouTube is also a great place on our channel. So yeah, that's
Just sharing the info.
yeah, sharing
Absolutely.
the knowledge.
Sorry,
There's comments there.
I think as a medical professional, one thing we forget, that our brain actually makes all the decision emotional, in the emotional part of that. We go all logical, we go all evidence, but the reason why they are so successful because they're likable, and they basically make everybody laugh, and they make everybody love it, what they do.
Positivity.
And I think this is what we as a healthcare professional need to do. We need to learn about the facts, and then learn from these guys how to be so passionate and so wonderful.
You're absolutely right. You know, when Dr. Burkitt, whose paper I mentioned earlier, when he passed away in 1993, aged 82, his obituary was published in the New York Times. And in that obituary, it outlined how his thesis on the diseases of modern society, he'd done such a good job spreading that thesis that he changed the way that millions of people eat for the better. And I think our panel are doing the same. I think Robbie Lockey, sitting there with the microphone, is doing the same. Now, before we open up to a general Q&A, which we're going to do for about half an hour, Spencer, any Q&A, I'd like to start the Q&A by asking Robbie and each of our panel members, this is the walk the talk test. What did you have for breakfast this morning?
What did I have for breakfast? I actually had Weetabix with oat milk and bananas.
Old school, old school. Ian and Henry?
What did I have?
I had like granola with plant-based milk and some blueberries.
Nice.
And some coffee.
And coffee, also, yeah, I'm with you on coffee.
I had double espresso and pizza.
I could vouch for that. Plant-based, right? Yeah, of course. Sue.
I had porridge and a grapefruit.
Classic. Dr. Williams? Who's traveling, so I understand you got to compromise when you're traveling.
The Capitol Hotel did pretty well. They have a homemade granola. I don't know who among them makes it. It wasn't too sugary, and had blueberries, strawberries, pineapple, bananas. You name it, I put it in there. And so, along with some shaved almonds and those little tiny seedy things.
They make me hungry.
Yeah, sesame seeds.
Oh, lovely. Stephen Flynn?
When we normally travel, we normally bring a food bag because you're normally caught in the hop. But we were at 4 o'clock in the morning. I wasn't bothered getting one. But we stopped in M&S and we bought Kalamata olives, guacamole, hummus, some corn chips, some cherries, some blueberries, some strawberries, some bananas, and some a mango. bag of greens. And a bag of greens.
And bag greens. And I presume, Dave, you had the same.
Yeah, we just grazed in the train.
And you stopped for coffee on the way?
Yeah.
You have one. Okay, perfect.